Ejaculating too little? The hidden risks after 45. Let me begin with a question that many men over 45 think about quietly, but rarely bring into open conversation. What happens if you ejaculate too little? Not too much. Too little. Is there such a thing as not enough? Can going long periods without ejaculation affect your prostate, your hormones, your mood, your relationships? Or is that just another modern myth? If you're over 45 and this question has crossed your mind, you're not alone. In clinical practice, I hear it often, especially from men entering midlife transitions. Some are married and less sexually active than they once were. Some are single after divorce. Some are focused heavily on work. Some believe that abstinence preserves energy. Others are simply unsure what is normal anymore. The confusion is understandable. Sexual health education for men tends to focus on excess, but rarely do we talk about insufficiency. And today, we're going to examine this topic calmly, scientifically, and without judgment. We'll explore what changes after 45. We'll discuss the potential biological consequences of very infrequent ejaculation. We'll look at prostate health, hormonal balance, vascular function, psychological well-being, and relationship dynamics. And most importantly, we'll talk about how to find a rhythm that supports your body rather than guessing. By the end, you'll have clarity grounded in physiology, not shame, not superstition, and not internet folklore. Before we begin, tell me your age in the comments and where you're watching from. I genuinely value knowing who this conversation is reaching. Now let's address the biggest misunderstanding right away. Abstinence is not automatically harmful, and frequent ejaculation is not automatically protective. The human body is adaptable, but extreme patterns, in either direction, can create consequences over time. After 45, several physiological shifts begin. Testosterone gradually declines, blood vessel elasticity reduces, sleep becomes lighter for many men. Stress responsibilities increase, career, family, aging parents, and the prostate gland itself often begins to enlarge, a condition known as benign prostatic hyperplasia. None of these changes are failures. They are part of aging, but they alter the context in which sexual health operates. Let's begin with potential hidden risk number 1, reduced prostatic fluid turnover. The prostate produces seminal fluid continuously. When ejaculation occurs, that fluid is released. When ejaculation is extremely infrequent, for months at a time, prostatic secretions can accumulate. Biologically, stagnant fluid may contribute to local inflammation in some men. This does not mean that abstinence causes cancer, but observational data suggest that moderate regular ejaculation may correlate with lower prostate cancer risk. A large study published in JAMA followed over 30,000 men for nearly 2 decades. Men reporting more frequent ejaculation, approximately 21 times per month in earlier adulthood, showed a lower incidence of prostate cancer later in life compared to those with very low frequency. Now pause. Correlation does not equal causation, but biologically, the hypothesis is plausible. Regular clearance may reduce inflammatory burden within the gland. Emotionally, this information often surprises men who assumed that less activity was always better. Practically, it suggests that complete long-term sexual inactivity may not offer additional protective benefit and could remove one potential mechanism of gland maintenance. Hidden risk number 2, diminished erectile responsiveness. Erections are vascular events. They depend on healthy endothelial function, the inner lining of blood vessels. Regular erections, including nocturnal erections, help maintain oxygenation of penile tissue. If ejaculation and sexual arousal become extremely rare, the frequency of full erections may decrease. Biologically, reduced oxygen exposure over time can contribute to subtle structural changes in erectile tissue. Emotionally, this may show up as weaker rigidity when intimacy resumes. Practically, men sometimes interpret this as sudden dysfunction, when in fact it reflects long periods of underuse. The penis, like any vascular tissue, responds to demand. Hidden risk number 3, hormonal feedback shifts. After ejaculation, prolactin rises temporarily. Testosterone fluctuates. Dopamine and oxytocin change. When ejaculation becomes very infrequent, some men report increased sexual tension, while others report blunted desire. Why the difference? Because the endocrine system adapts differently depending on baseline hormone levels, stress exposure, sleep quality, and psychological context. Biologically, prolonged suppression of sexual expression does not necessarily increase testosterone in a sustained way, despite popular myths. Short-term abstinence may transiently elevate testosterone, but long-term patterns tend to normalize. Emotionally, men sometimes expect abstinence to increase drive dramatically and feel confused when it does not. Practically, sexual rhythm tends to be healthiest when aligned with overall vitality, not when driven by rigid ideology. Hidden risk number 4: increased pelvic congestion discomfort. Some men over 45 report dull pelvic heaviness after long periods without ejaculation. This is sometimes referred to informally as pelvic congestion. Biologically, increased pressure within prostatic and seminal vesicle structures may contribute to discomfort. Emotionally, men often dismiss this as unrelated. Practically, moderate sexual release can relieve that pressure in certain individuals. Hidden risk number 5: psychological rigidity or avoidance. Sexual inactivity is not always biological. Sometimes it reflects emotional withdrawal. After divorce, betrayal, grief, or chronic stress, some men unconsciously disengage from intimacy. Biologically, stress hormones like cortisol suppress libido. Emotionally, avoidance may protect against vulnerability. Practically, prolonged avoidance can erode confidence, making re-entry into dating or partnership more difficult. Here is an important distinction. Choosing abstinence for spiritual, relational, or personal reasons is one scenario. Avoiding sexuality due to anxiety, shame, or fear is another. The physiology may look similar, but the psychological impact differs significantly. Hidden risk number 6: reduced intimacy, bonding in relationships. In partnered men, extremely low sexual frequency can gradually reduce oxytocin-mediated bonding. Oxytocin increases during intimacy and orgasm. Biologically, it reinforces trust and connection. Emotionally, couples often feel closer after physical closeness. Practically, long-term absence of intimacy may create distance, unless both partners communicate clearly and mutually agree on the rhythm. Hidden risk number 7: sleep and stress imbalance. For some men, ejaculation functions as a stress reset. It activates parasympathetic pathways. If sexual release is completely absent and no alternative stress regulation exists, such as exercise, meditation, meaningful conversation, tension may accumulate. Biologically, chronic stress elevates cortisol and inflammatory markers. Emotionally, this may appear as irritability. Practically, sexual health is one component of a broader stress management ecosystem. Now let's clarify something important. None of this means you must ejaculate a specific number of times per week. The body does not operate on quotas, but extremely low frequency over long durations, particularly when accompanied by reduced erections, pelvic discomfort, or emotional withdrawal, may signal imbalance. So what does balanced frequency look like after 45? Clinical observation suggests that many healthy men in midlife feel stable with sexual activity ranging from once or twice per week to several times per week. That range supports vascular activation, gland clearance, and relational bonding without overwhelming recovery. But again, this varies. A 47-year-old endurance athlete will differ from a 63-year-old managing hypertension and diabetes. The body provides feedback. Pay attention to it. Ask yourself, do I still experience spontaneous morning erections? Do I feel confident when intimacy arises? Am I avoiding sexuality or simply less interested? Do I feel tension build without release? Is my relationship affected? If you choose abstinence intentionally and feel energized, focused, and emotionally grounded, that is valid. If you avoid ejaculation out of fear that it drains masculinity, that belief deserves examination. Energy loss after ejaculation is typically short-lived and influenced more by sleep and nutrition than by the act itself. Let's address prostate cancer directly. Low ejaculation frequency does not automatically cause prostate cancer. Cancer risk is multifactorial, influenced by genetics, inflammation, obesity, insulin resistance, and environmental exposures. Regular screening remains essential. PSA testing and appropriate medical evaluation cannot be replaced by sexual habits. So where does that leave us? The hidden risk of ejaculating too little after 45 is not catastrophic failure. It is subtle imbalance, reduced vascular stimulation, possible fluid stagnation, emotional distancing, diminished responsiveness. These changes accumulate gradually, and the encouraging truth is this: they are reversible. Erectile tissue responds to renewed circulation. Hormonal patterns adapt. Pelvic discomfort often resolves. Intimacy can be rebuilt. The body remains adaptable well into your 70s and beyond. So what practical guidance can we extract? First, eliminate fear-based thinking. Ejaculation is not inherently depleting, nor is abstinence inherently superior. Second, aim for rhythm rather than extremes. Third, maintain overall metabolic health, exercise, sleep, weight control, stress reduction. Fourth, communicate openly with your partner if you have one. Fifth, seek evaluation if you notice persistent erectile changes, pain, blood in urine, or progressive urinary symptoms. Sexual health after 45 is not about performance. It is about circulation, hormonal harmony, psychological connection, and long-term vitality. And here is the empowering part. You are not fragile. Your prostate is not a ticking time bomb. Your masculinity is not measured by frequency. It is measured by awareness, balance, intentional living. If you've been ejaculating very infrequently and feel well, there may be no problem to fix. If you notice tension, discomfort, or reduced responsiveness, small adjustments may restore equilibrium. Your body speaks in patterns. Listen to them. If this conversation helped clarify a topic that is rarely discussed openly, consider subscribing for weekly evidence-based discussions about men's health after 45. And tell me in the comments, have you noticed changes in your sexual rhythm as you've aged? Remember this: real strength is not about extremes. It's about awareness, balance, and making choices that support your long-term vitality. Your health deserves intention, and you deserve clarity, not confusion.